Collins Kofi Opon of Empire Africa. We are here live at the Open Cities Health Center for the importance of men's health program.
My name is Albert Shakim. I forgot myself. I'm also in the outreach team, but I'm also the director of men's health. So I'll deal with you guys on one-on-one maybe. But thank you so much for coming. And I'm going now to invite Chester, who is going to, from the admin, to say something and also introduce our first speaker.
Hello everyone, my name is Chester Tyke. I am the CFO here at Open Cities. I've been here for about 2 years now. When Al said he's holding a men's health event, I was surprised he came and approached me to speak, considering that I guess I'm a man, so I got one of those two things down. But men's health is it's something very serious. It's very serious to get checked out once a year at least. Here at Open Cities, we offer numerous procedures and numerous things that can help you in any way, shape, or form. We have chiropractic, we have medical, we have dental, we have optical, and one of the most important ones, behavioral health. A lot of people don't talk about behavioral health a lot, but it's very important to have a healthy body and a healthy mind.
My name is Councilmember Dai Tai. I represent this area in the St. Paul City Council. Thank you, Dr. Al, and thank you, the Honorable Speaker, for allowing me to join you all and have this conversation today. Men's health is important because whether you look at the human species or in the natural world, the father, the male, we play a significant role in shaping our society, shaping our kids, shaping the community, leading the community, creating change in history, and creating change now. I remember when I was a kid growing up, my father, when I was going to middle school, my father, he went back to Laos to join the communist resistance. He was a soldier. He joined the war when he was 14, and that's how he was make a living, fighting alongside the United States. And so when I was going to middle school, he went back to join the war. And so my mom raised the rest of us on her own in the public housing. And for a long time, I didn't know what I was wrestling with. It was a sense of, I feel like there was no disclosure. There was no closure between my father and I. And I felt like abandoned, but I couldn't put a word to that. And so I was struggling through those things, those trauma in my early adult life. And it was having an effect on my work, having an effect on my family life, my social life, but I couldn't name it. I didn't know what it was. And then in our culture, we were raised to be tough. Men don't cry, boys don't cry. We are tough, we could just handle whatever. And so it was really hard until I finally did the right thing by reaching out and talking to someone who can help me deal with that, like a counselor. And we were there to talk about something in the present. But there was this thing that was boiling up inside for me for years, is to talk about my father and our relationship, and how I wish I could have said to him that how much I loved him, and that if I could just go back, I would chain him to the house so that he wouldn't leave us, because that's how much I missed him. And we started having that conversation about my father, and I just started crying, and it felt great. Like, it was okay. And after that, I felt like there was some closure. I feel like now I feel like I could move on, and then I mourn the loss of father and son time, mourn the dream that could have been, or the opportunity that could have been. And so I hope that, you know, and I'm still working on those things, right? And the work that I do is very stressful and a lot of responsibility and different things. And so I have mentors, I have folks that I could reach out to, folks that I could talk to. I talk to my kids about it, and that with my son, I said it's okay to cry, you know, it's okay to reach out, it's okay if you make a mistake, it's okay to reach out for help. And so I'm practicing those as well. And so me being here in front of you, it's a real honor to be here, and I think it's really important as men is for us to also be vulnerable. Our vulnerability doesn't make us weak. Actually, it helps us to identify things that we need to work on as a collective, as brotherhood, and it takes all of us to help each other. If you know, if brother here, if he does well, I do well. You know, if I do well, he does well.
All right, so first and foremost, welcome everybody to this Men's Health Conference. Thanks to Al for inviting me and asking me to come speak. I was a little shocked and surprised, but also very willing to do it. I was like, you want to hear me say something? I can roll with that, I can dig it. One of the things earlier that Councilmember Dytow talked about was, he spoke about in his culture how, you know, it was taught to them, men are not supposed to, cry, not supposed to open up, not supposed to be sensitive, that you got to be tough, got to suck it up, stuff like that. I don't think that that's anything that is exclusive to Hmong culture. I think that that is very indicative of any culture across the board, especially when it comes to males. I'm also here to tell you that is a quick and easy way to make sure that you will die faster than anybody else. We need to make sure that we as men move to that same mindset. Stop getting to the point where we feel like, anytime we express any type of discomfort, anytime that we're dealing with something, that is a sign of weakness, because it's not. The fact that we are afraid to go get checked out and stuff like that, that is in fact a sign of weakness, because that speaks of insecurity on our behalf, and we need to get past that. But no matter what race or whatever, our women counterparts are outliving the males, and it's because they're getting looked at, they're getting checked out for. We need to start doing that. We are suffering from the United States in general is the most unhealthy, most obese nation in the world. I need you to think about how significant that is, seeing as how we're also supposed to be one of the more wealthier nations in the world, and we're not considered a third world country. So we have all the resources available and all the resources possible to make sure that we're all being taken care of and living a happy, healthy life, yet that isn't happening. We are battling things such as high blood pressure, diabetes, chronic disease and illnesses that are happening coming up on us because of issues with obesity, not taking care of ourselves, not getting adequate rest, not eating right, not exercising, smoking too much, drinking too much. Men are drinking more than women, which leads to things such as esophageal cancer, stomach cancer, colon cancer, throat cancer. We're smoking more. But yet, when we come down with a little a little cough, we refuse to go in. We're not even getting our annual checkups. And for a lot of us, the annual checkups, I know that we're afraid of, accruing, significant medical costs. But for a lot of us who have, or either on our employees' insurance, or maybe have insurance to the state and stuff like that, it doesn't cost us much to go get an annual checkup, to get looked at. And all those things play a very significant part in, our preventative measures. Guys, go get that annual checkup. Go get looked at. Especially if you're a man over 40, you need to go ahead and do things like, you need to make sure that you're going in and you're getting checked for your prostate cancer every 5 to 10 years. Because there's nothing like going in and finding out you have an issue or something like that, and realize that if you had simply gone and gotten a checkup, getting a procedure done that could, take a few hours out of your day could save your life. And then some of the basic things, then stop eating like crap. Get out and exercise. Meet at least a minimum or requirement for exercise a day. There's nothing stopping us from getting out, and taking a walk for an hour. Working out in between, during commercial breaks while we're watching the game. There you go. We don't like to do any of those things. And those are the very things that can save our life. Those are the very things that can keep us from having to pay these exorbitant medical bills that we're reluctant to pay, that we don't want to pay, that we're afraid of going getting checked out to have to pay. And so if we can do these basic things like eating healthy, being preemptive, like going and getting our annual exams, stuff like that, and being humble enough to admit when something is actually wrong with us, we ain't helping anybody else but ourselves. And the last but not least, one thing that I really want to address and just kind of say, and make sure that I stay within my time, is like addressing like your mental health issues. Because I don't care how good anything else is going, if your emotional and mental well-being isn't taken care of, I can assure you that your physical well-being will follow suit. There's nothing wrong with admitting that you may have issues with depression. Nothing wrong with going to talk to somebody with the fact that you don't remember the last time you've been happy. There are some things that exercise and maybe even going to church just can't help. Sometimes you need an extra boost. But it all starts with us making a decision to want to help ourselves. What's the age old saying, like, help me help you? And for anybody else to be able to help you, you got to be able to help yourself. If you're not willing to bet and gamble on yourself, if you're not willing to put as much effort in yourself and love yourself as much as we love some of these other distractions out in the world, where else can we get and where else can we go?
African American men have been documented to be impacted disproportionately by a host of health issues. Cancer of the prostate and or colon, high blood pressure, hypertension, diabetes, poor oral health, and stress, to name a few, are great contributors to a shortened life expectancy. We have to be concerned and not ignore both physical health as well as our mental health. One of the key reasons that men do not seek out mental health is not just because they're strong. Men in general have an issue, especially African American men, with one word: confidentiality. When I was growing up, or when I was grown, but going here to college, there used to be a place, I was trying to think of the name of it, where you would go in to get your condoms and get sex health checkup.
Red door.
Say it again?
Red door.
Well, it wasn't quite the red door, it was the back door. But anyway, or the whole issue of AIDS or something. If you were seen coming out of a certain clinic or a certain facility, people automatically assumed you had a certain condition or a certain illness. So that took away from people seeking health. If people, I transport people quite a bit who are not able to get to the doctor, and I recall taking a person who couldn't afford transportation to the Mayo Clinic in Rochester. But when I got back to the Twin Cities, it had already gotten ahead of me that Robert McLean has cancer. Where'd you get that from? Because I was seen coming out of the Mayo Clinic of Rochester. And so you have a place like Open Cities, community-based, that allows for treatment and allows for the protection of what's called confidentiality, that men try to make sure that is in place. Make sure that, because I come here, and many of you who work here now, Dr. Hume and other people, are new to this community. But most of the staff here I've known for years, even prior to coming to Open Cities. And so when you come here, I expect for what I come here for, whether it's a hangnail or whether it's for whatever, that is kept confidential. I don't want to go into the VFW, Johnny Babies, or the Elks, and hear about my whole medical condition or psychological treatment. That is the key for getting good health care, is knowing that you're going to get good care, that you're able to talk to a doctor, man to man or man to woman, whatever the case may be listened to, be heard, and be told honestly what your situation is and how to address it. Confidentiality is a very important word. There are many men who want to go to the doctor, but they want to be sure that their business is their business. And so that's one of the things I like about this clinic. They assure people, even if you recognize the nurse who's taking your blood pressure, she's not on the phone and say, "Oh, Clarence has high blood pressure. You know he loves that pork." You know? And, or if I'm here to see the psychiatrist for one reason or another, that I won't hear about it before I get back on the street. Your attendance in this event is a step in the right direction. Your family, your community, your friends, Open Cities Health Center staff, and I love and value your being healthy. Open Cities Health Center is committed to serving the needs of the community. You have not been invited here to be pressured or harassed, but I hope that you will find this experience useful and a source of motivation to continue on the journey of personal engagement and better health. The key to better health is your commitment, not your girlfriends, not your wife, not your mama. You have to have that personal commitment to engage yourself, to want to live better, to feel better, to not ignore that slight sharp pain just went through your hip, to not ignore that your vision is getting a little blurry, to not ignore that you can't hear as well as you used to could, even though your wife thinks you can never hear. But the thing is, men have to stay on top of their health as much as possible. Not just the physical health, the mental health. By doing this, you increase your chances of living a longer, healthier, and productive life. Thank you very much.
Thank you. We have wise men here, they give us advice, and so I guess we have to remember and also to write down. We have papers that given to you if you want to jot down some points, do that. And also after the meeting, you can run their contacts, you can ask them, talk to them, they can give it to them. One announcement, we have a new care, did you see the table there? Yes. The hallway? Yeah. Yes, she really wanted to interact with us, and because our health is very important. So when you finish, or if you have time, after the meeting, you can just go there to the table and talk to her. Then she can tell you what you care does in their services. Also, before I invite another speaker, the last speaker, I want to introduce the TV crew who are here. Please, I want to welcome Collins, the program director, and then he can introduce the rest of the team. Help me to welcome.
Thank you very much, Dr. Abasha. My name is Collins Kofi Opon. I'm the programs director as well as the business director of Empire Africa. And I would like to introduce the head of production, Mr. Ahmed. And our general manager, Lovette. The CEO, Mr. Dixon, stepped out to get something really urgent to continue with the broadcast. So yeah, Empire Africa, we are a media firm in the Twin Cities, located in Brooklyn Center. Our idea is to connect the community with events like this, with programs like this, and one of the things we do is a podcast program, and the podcast is also used to do everything that is needed in the community. So we have health podcast, we have business podcast, we have community engagement podcast, we have segments just connecting leaders in the community. So our idea, like I said earlier, is to keep connecting, is to make sure that whatever is important in the community is broadcast so that the outer world will hear about it. So that's why we're excited to be part of the Open Cities Health Center, the importance of Men's Forum, and we are glad to be here. So please, if you want to reach out to us, I'll be here to talk to you. If you have any questions, there's any events that is going around that you want us to be part of, we'll be glad to do so. Thank you.
How you doing? You know, my man says something about exercise, right? So before I start, I want you all to know I brought my 30-day exercise plan.
Wow.
Pass it around. All right, wait, make sure you check your doctor before you exercise, right? Okay, this is my 30-day exercise plan, cardio exercise.
Wow.
30 days, you can do it for a woman, man, kids. It's outside, it doesn't cost you any money. You know, there's a very good outreach person here named Bernadette. And I had Bernadette on my radio show a couple Mondays ago. And Bernadette said, Lucky, I want to invite you to the men's group and talk about health. And I said, you don't want me to talk about health. I haven't been to a doctor in over 15 years. And she said, well, that's exactly why I want you to go and talk. I have not been to see a doctor, you all, in over 15 years. If someone said you should see a doctor at least once a year,
Yes.
let me tell you why. I had to think about why I have not been to see a doctor in over 15 years. Because of excuses. I'm years old, and I go to the gym, and I meet people in the gym that are 23, 24, 25, and I'm doing more push-ups than them. I'm lifting weights the way they are. So I figure, I don't need to see a doctor. I'm in good shape. And then when I thought about it, and I heard about what some of you all said, when I was growing up, there was this thing that I called the socialization cycle of denying myself good health care. And let me tell you what I mean by that. When I was growing up, I heard my dad, Tiger Jack, who said, I need to go see a doctor. I'm okay. I heard my uncles say it. Hello? My uncles. My grandpa. Grandma. When I was growing up, they all said, I don't need to go and see a doctor. So naturally growing up, that was my socialization when it came to seeing doctors. Hello?
Yeah.
But what I realized, you all, it wasn't about being macho. It wasn't about my dad being macho. It wasn't about my mom being macho. It was about us being what I didn't know, being poor. Being poor, and my dad had to decide if he was going to go to see a doctor and pay a doctor bill, or pay a bill to keep the lights on in the house, or pay the bill to buy me a pair of tennis shoes, or a shirt, or something that I needed. So it was not about being macho. So I want us to think about what I've heard about being macho, that's true. But a lot of times, you guys, it's about being poor. When my son was growing up, I did the same thing. If I take my son to see a doctor, what am I going to have to trade off? What am I not going to be able to pay for? How many of you all have been confronted with that?
All right, this is Collins Kofi Opon of Empire Africa. We are live here at Open Cities Health Center, covering the event which says the importance of men's health. And I have with me Lucky. How are you? Yes, so you were one of the speakers, very inspiring speech about exercising and also the need to see the doctor. Give me just overview of what you just taught to us.
Well, I think a couple of things. I think that when we talk about black people going to get health services, we always want to talk about the fact we don't want to go because we're macho. We're too macho man to go. That's not always what it is. What it is sometimes is the fear I don't want to go to see a doctor because I have a fear of what he may tell me. I don't want to go and see a doctor because I don't have the money to pay for the doctor. Even though I may have a deductible, if my deductible is $200, I have to pay $200 for my deductible. Then I have to decide what bill I'm going to pay. If I don't pay that deductible, it goes into collection. Next thing you know, my credit gets bad. So we got this cycle of socialization that keeps going on and on and on, why black people do not want to go and see a doctor. Especially when it comes to seeing my dad, my uncle, my family members saying, I'm not going to see a doctor. I've learned not to go and see a doctor, and that seems normal to me. So we got to break out of what is normal for a black man not going to see a doctor, and it's not always about being macho. Sometimes it's about just not having the money, and it's about being afraid of what I'm going to be told if I do go. So we got to break those kind of barriers.
So how do we break these barriers? And going forward, how do we encourage and, of course, make it more accessible for men like us to see the doctor?
Outreach and education. We can't sit inside of a clinic and expect people to come to us. If we're serious about this, we've got to figure out ways we can go out to the community. We can go out to organizations like yours. We can go out to the schools. We can go out to the churches. We can even go out on the streets and talk to people on the streets about health care. We can't always wait for them, brother, to come into us.
All right, thank you so much, Lucky, for speaking with us. I'm here with Joe. Joe, just tell me a bit about yourself.
My name is Joe Weinberg. I'm the campaign director here at Open Cities Health Center.
All right, so what went into putting together this particular program?
Well, all the work was done by Al Basha. He put together a list of people to call. We called a bunch of people. We asked a bunch of people to come and speak. We set up. We put together these folders. It was a lot of work. Al Basha did a really good job.
All right, so from the session today, what do you want participants to go home with? And of course, those watching us from their homes, what do you want them to take?
I would say the most important thing for people to take home is that importance of mental health. Taking the time to go and talk to somebody and getting that help to make sure that your mind is in the right place, because everything else does flow out of that. And so that's really important.
All right, thank you so very much for speaking with us, Joe. Thank you. All right. I'm here with Cheska, and of course, tell me a bit about yourself. You work here, right?
I work here, yeah. I'm actually the CFO here. I've been CFO for about 6 months now, but I've been here for over 2 years. So, yep.
Great. So, yeah, tell me, what did you pick from this, and what do you want those listening and watching us from home to take from this session?
I want everybody to know that men's health is very important no matter who you are. It's very important to get checked out, and a big takeaway is the mental health prospect. You know, a lot of people, some people think that, you know, it's a sign of weakness, but if you're not doing too well, just go see somebody, go talk it out. There's a lot of things out there to help you.
So there's accessibility for men, and we need to take advantage.
Absolutely.
Thank you so much for speaking with us.
Thank you, sir.
Thank you. All right. So you are in attendance to this conference, which has to do with the importance of mental health. What did you learn from this session?
I learned the importance of partnering with your healthcare professionals and overcoming your sort of macho stigmatism, not to seek help and to tough it out, but to really create a community around health. Yeah.
Thank you so much, and I appreciate you talking to us. All right, thank you. I'm here with William. He was one of the speakers for this program, the importance of men's health. How are you, William?
Very good. How are you?
Great. All right. So, in the nutshell, what did you want participants to take from your delivery and those watching us from home?
They're really taking initiative and investing in your own healthcare is investing in yourself, right? Self-care is the most important thing. I know everybody out here, like, we have busy lives. We're worried about 10 million other things. You know, you're working, you're worried about getting the bills paid, you're worried about taking care of your kids, everything else. But none of those things can be done if you're not taking care of yourself first. You know, so self-care is the most important thing. And self-care, you know, people use that phrase when we're talking about mental health, but self-care doesn't just pertain to just mental health care. It's mental health care, physical health care, emotional health care, all of the above.
Thank you so much for sharing these nuggets of wisdom with the participants. We appreciate you.
Right,
here with Ken. Good to see you, Ken. All right, I saw you. Can you come to the side a bit? All right, so I heard you ask a question, and that was really important, especially when people come to your home and they're wondering why you keep so much healthy food. How do you handle situations like that?
I mean, I tell them, look, it's just a lifestyle change. It's for me personally. I mean, I don't try to push it and pawn it off on anyone, but it is a suggestion. I mean, because we all do need to eat healthier, You know, I mean, not just straight up go full blown vegan. You know, but it's a gradual thing. You know, as far as like, you know, varying it. You know, laying off the fried chicken every day. You know, transitioning into more baked goods. You know, things of that nature. You know, eating more salads. I mean, and you can vary your salads. I mean, there's so many variations of salads nowadays. It's not even funny. You know, eating healthy, like, you know, instead of eating a candy bar, eat some fruit. You know, a granola bar with some yogurt. You know, things of that nature. And I mean, as far as seasoning goes, there's all types of herbs and things of that nature that you can use to, you know, spice up your meal, your salad, that sort of thing. You know, I mean, just experiment. That's all. You know, that's amazing.
All right, thanks so much. I mean, I took a lot from that, so I appreciate you sharing this with us.
No problem. All right. Yep.
All right.
Got to be good looking 'cause he's so hard to see. Come together right now. Oh, me.